EV-301 was a randomized phase 3 trial of Enfortumab vedotin, or standard chemotherapy, in patients with metastatic bladder cancer or upper tract urothelial cancer who had progressed on a prior platinum therapy and also on a checkpoint inhibitor. And so those results, the initial results, showed a survival benefit for patients receiving Enfortumab vedotin. It was the interim analysis, and this represents the final analysis. The interim analysis became the final analysis, and this is a long-term analysis that was reported at ASCO 2022. And so we reported the 24-month follow-up of patients on study and showed that there was a 10% increase in 2-year survival from just shy of 30% for Enfortumab vedotin compared to just under 20% for patients treated with standard of care chemotherapy. And while that's not a spectacular number in itself, we had not been thinking of 30% of patients being alive 2 years after third-line therapy in the past, and really shows that there are patients who get significant benefit from Enfortumab vedotin. And the results confirm essentially the interim and final analysis. The toxicity profile hasn't really changed since the initial report. There were a couple of extra cases of rashes, but most of the skin toxicity that occurs with Enfortumab occurs early in the course of treatment.